Dengue fever and dengue hemorrhagic fever are both caused by the dengue virus, which is transmitted to humans through the bite of infected Aedes mosquitoes, primarily Aedes aegypti and Aedes albopictus. Here is a detailed explanation of dengue and dengue hemorrhagic fever. Transmission. Dengue fever is transmitted to humans when an Aedes mosquito infected with the dengue virus bites a person. The virus enters the bloodstream and infects various cells, leading to the onset of symptoms. Incubation period. The incubation period of dengue fever ranges from 3 to 14 days after the mosquito bite. Symptoms. Symptoms of dengue fever include sudden onset of high fever, severe headache, muscle and joint pains, nausea and vomiting, skin rash, mild bleeding manifestations like nosebleeds or gum bleeding. Diagnosis. Diagnosis is usually based on symptoms and confirmed through blood tests that may show low platelet counts. Treatment. There is no specific antiviral treatment for dengue fever. Supportive care includes rest, adequate fluid intake, and medication for fever and pain relief. Aspirin should be avoided due to the risk of bleeding. Prognosis. Dengue fever is usually self-limiting, with symptoms resolving within a week. However, in some cases, severe complications can occur, leading to dengue hemorrhagic fever. Severity. DHF is a more severe form of dengue fever and can be life-threatening if not promptly recognized and treated. Symptoms. In addition to the symptoms of dengue fever, DHF is characterized by severe abdominal pain, persistent vomiting, bleeding from the nose or gums, blood in the urine, stools or vomit, signs of plasma leakage leading to shock. Complications. DHF can progress rapidly to dengue shock syndrome, DSS, where severe plasma leakage leads to shock, organ failure, and potentially death. Treatment. Treatment of DHF involves hospitalization for close monitoring, intravenous fluid replacement, and blood transfusions if necessary. Early detection and management are crucial to prevent complications. Prevention. Prevention of dengue and DHF primarily involves vector control measures to reduce mosquito breeding sites and protect individuals from mosquito bites. In summary, dengue fever and dengue hemorrhagic fever are caused by the same virus but differ in severity and clinical manifestations. While dengue fever is usually self-limiting, DHF can progress to a severe and potentially fatal condition if not managed appropriately. Public health efforts focus on mosquito control and early detection to prevent the spread of dengue and reduce the burden of these diseases on affected populations. Dengue cluster indicates a locality with active transmission where intervention is targeted. It is formed when 2 or more cases have onset within 14 days and are located within 150 m of each other, based on residential and workplace addresses as well as movement history. The clusters are categorized according to their current statuses. A list of preventive actions also accompanies each alert level. There are 3 alert levels: high-risk area with 10 or more cases, red alert; high-risk area with less than 10 cases, yellow alert, no new cases, under surveillance for the next 21 days, green alert, to find out the current dengue/Zika situation in Singapore, and active cluster.